Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Okay, so you're welcome back. This is the Drive with the Area Gang, and we are live on PLUZZ 89.9 FM. It is time for Hello Doc. We've got Dr Emefa Dzide with us here in the studio this afternoon. Hello, Doc.
Hi.
How you doing?
Very well, by God's grace.
Yeah, you're welcome.
Thank you.
I can see you have your pink ribbon on.
Yes.
Yeah, it's October, so breast cancer.
Breast cancer awareness.
Yeah, it's what we're looking at. And we started our series this month, last week, Monday. I want us to do a quick recap, just for the benefit of somebody who didn't listen last week, Monday. If you can just give us an overview of what breast cancer is. I think we talked about types of breast cancer. We talked about signs and symptoms, just to recap from last week. And then we get into this week's discussion.
Okay, sure. So last week we went into what exactly is cancer, and I said that cancer is when we have uncontrolled multiplying of cells in the body. So when this occurs in the breast cells, then it's breast cancer. The prevalence, I mentioned, it's not very well known because not a lot of people have been screening and testing to be able to get a very clear picture of the prevalence of breast cancer. But we know it's more, about 99% of cases are in females, and then just 1% in males. The signs and the symptoms, I mentioned that it's not just the breast lump that will show you have breast cancer. You might have changes in the skin, changes in the nipple itself, maybe a nipple discharge. Sometimes there's one breast can just enlarge suddenly, with pain. It might look like an inflammation or an infection, but actually it might turn out to be a cancer.
Okay.
And we talked about risk factors, obesity, and
Age?
yes, age is about 50 years, and then smoking, cigarettes, alcohol, obesity, taking hormone replacement therapy.
There are some people who wouldn't agree with that. They're saying that how can smoking also has anything to do with the breast? How can drinking alcohol have anything to do with the breast?
It is not my opinion. It is actually people who have collected the data, looking backward and seeing all those with breast cancer, and they found out that a lot of them had a history of alcohol and then smoking. And it actually shows, when you do a prospective study too, it shows that if people are actively taking in a lot of alcohol and smoking, they tend to get cancers in general.
Okay.
Yeah.
We busted a few myths as well. Any that will come to mind immediately?
Just that keeping your phone close to your breast can cause breast cancer.
Nah, we realize that is not true.
Yeah.
Okay, let's get on to today's discussion. Today we're taking a look at detection and diagnosis of breast cancer, and later on we'll look at the stages of breast cancer as well. So if you can just walk us through the different methods, first and foremost, of breast cancer detection.
Okay. Yes. So the initial one is the screening, and I mentioned it that you have to do the breast examination, looking at the breast very carefully, not just pressing to see for lumps, but looking at the skin, the nipples, seeing if there's any lumps in the armpit as well, because the lymph node could also be a sign of breast cancer. Once you do that after screening, you would want to further do some imaging. You might do breast ultrasound or a mammogram, or MRI scan of the breast. So once we are able to confirm the lump or the abnormal tissue, then we will do a breast biopsy. So that can either be an open biopsy. They might have to cut and then try and remove the lump, or they'll do a fine needle aspiration where they put a needle in and just suck up some bits of the breast cell to go and look at in the lab. There's also immunochemistry tests to check for hormone receptors to see if there are hormones in the body that the cells are feeding on to give them to help them to reproduce. And then also there's the genetic testing to see if you have some genes that are markers of breast cancer. Yeah.
Okay. Let's look at mammogram, because it's a word that keeps being bundled around whenever you talk about breast cancer. What exactly is mammogram, and how does it work? What can it detect?
Okay, yes. So mammogram, it's an X-ray, but of the breast tissue. Yeah. So it actually helps to look at the nature of the tissues inside the breast, and then you can be able to tell if there is an abnormality or if there's a lump that has started forming in the breast. Yes, so it can detect some cancers at an early stage, but some cancers, especially those that don't really present with the lumps, they might not be easily detectable with the mammogram.
Okay.
But most of the others, generally, you should be able to detect them early enough with the mammogram.
Okay. And then there's the ultrasound and then the MRI. I don't know if these are more powerful ways to diagnose breast cancer compared to the mammogram. If you can explain it, and then let us know the different stages that you might want to use it.
Okay. So let me say MRI is, above both the ultrasound and then the mammogram.
Okay.
Yeah, but the ultrasound, depending on maybe the size of the breast and then how, should I say, dense the breast tissue is. Yes. Sometimes mammogram, because the tissues are dense, the mammogram will not be able to pick it very well. So ultrasound can be used.
Okay.
Yes.
Okay.
So it depends.
But when you talk about the size, is it like physically, like this breast is, it's
Yes,
big size,
yes.
and that will make it difficult to for the mammogram to detect?
No.
Okay. Let's get it right.
The bigger the size, the easier the mammogram will get it. But if it is the smaller breasts, which are more dense, yes, they are more likely to not be able to be well detected with the mammogram. So we'll use the ultrasound.
Okay. Now, how accurate are breast cancer diagnostic tests?
Okay. Well, when you talk about the diagnostic test, the gold standard that we use to diagnose definitely that this is cancer, we use the biopsy.
Okay.
Yes, but the others just give you an idea, or would maybe point you to go and do a biopsy or to hold on.
Okay.
Yeah. So you combine the test from the imaging results with your history and examination findings to decide. So maybe the mammogram might not show you much, but because of the complaints that the person is having, or maybe you feel some lymph node, you would want to go forward and then do a biopsy.
Okay. Now let's quickly go over that, because I know around this time we're doing a lot of screening on breast cancer. So exactly what will be happening at some of these screenings? Is it a mammogram that will be done there, or what would be done at these screenings?
Okay. The screenings, what we are doing at the hospital, we are just doing a physical examination.
Okay.
And then we take a bit of history from the woman. So if maybe there's a family history of breast cancer and all that, and then we will assess her risk based on her age.
Okay.
Yes.
Okay.
That's all we do. But I think we have some discounts on mammograms this month.
Okay.
And breast ultrasounds this month. I think there's a place just by the hospital where they have a discount there as well.
Okay. So if you're a lady especially, you want to take advantage of some of these activities during the month of October to get screened. But now let's take a look at the stages of breast cancer. Can you explain the different stages of breast cancer?
Okay, yes. So we have 5 stages.
Okay.
So first is stage 0. Stage 0 doesn't mean you don't have it.
I was thinking stage 0, you don't have breast cancer.
Stage 0, you do have breast cancer, but it's very localized. Okay, so probably it's maybe within the ducts or something. So it's very localized to a small area, and it hasn't spread to the neighboring breast tissues. So that one is like a very small lump. When they check, it's just a small area that is affected. Yeah, so that's stage 0, and normally it's not really a big deal to deal with that one. They quickly just try and remove the lump and then move on. Stage 1, that's when there is you see the cancer cells, and then there's a neighboring area which also has some cancer cells, but it's not gone to the lymph nodes. As I mentioned, the armpits and those things, it's not gone there yet. It's just a small lump, but you can see signs that it's affecting the neighboring breast tissue in the same breast.
Okay.
Not in the other breast. Okay. All right. So then we have stage 2. So stage 2, that's where you see more of the cancerous cells, and depending if it's a lump, it's either between maybe 2 to 5 centimeters in its widest diameter. Yes. And stage 2 can include the lymph nodes if the lump is smaller than 2 centimeters and then there is some lymph node.
Okay.
We'll still consider it as stage 2. But normally there shouldn't be lymph nodes, and it should be between 2 to 5 centimeters diameter.
Okay.
Yeah. Then stage 3, that's where it's more of getting an advanced breast cancer. So there, it may or may not be big, but there's extension to the lymph nodes.
Okay.
Yes.
Okay.
Then stage 4, which is the point of no return.
So you get to stage 4 and then it's like you can't even treat it, right?
Well, you can treat, but you can't completely cure and then be in remission like the other stages.
Okay.
Yes.
Okay.
All right. So stage 4, that's when it's spread to other parts of the body, spread to other tissues. So it can go into the chest, into the bone, into the lungs, into the spine, into the brain, and all that.
Wow.
So yeah, that's
Now,
stage 4.
how does the various stages impact treatment options and prognosis of breast cancer?
Okay, so with prognosis, the lower the stage, the higher the chances of survival.
Okay.
Yeah. So from stage 0, that means you have the highest chance of survival. Yeah. But the treatment options, stage 0, I mentioned, it's just the removal of the lump. Stage 1, they remove the lump and then they will follow it up with radiotherapy.
Okay.
But people who have like family history of breast cancer, or maybe the breast cancer is the very aggressive type, they would want to opt for the complete removal of the breast, what we call the mastectomy. Yeah. So that's stage 2. Stage 1.
Stage 1.
Sorry, that's stage 1.
So stage 1, you can actually. I was thinking stage 1 is cool. You can actually have a removal of the
yeah, you can
breast.
remove just the lump.
Okay.
Yes, but you may, depending on the risk factors and all that, you may decide to remove the whole breast, and then you follow up with the radiotherapy.
Okay.
Yeah. Then stage 2, we'll do the total mastectomy, more likely. But again, depending on the size of the lump. If the lump is not that big, you may want to conserve the breast tissue. But if it's big enough, you may want to just take off the whole breast, and then they will remove the affected lymph nodes. Yeah. And then the test that I mentioned, the immunotest, we would want to do these hormonal tests. Some of the cancer cells feed on estrogen, progesterone, other hormones that the body produces. So once we do that test and we find out that it's feeding on one of these hormones, then we also have to give treatment for that as well. And we may or may not give chemotherapy depending on the individual condition. Yeah. Then stage 3, that one definitely will have to give chemotherapy, and we'll do the mastectomy as well. If the lump is too big, we might do chemotherapy first to shrink the size of the lump before we do the surgery, and then either continue with chemotherapy or do radiation therapy as well. Yeah, so that's stage 3. And stage 4, usually the goal is just to prolong life and then increase the quality of life.
Okay.
Yeah, because there's no way to completely remove the cancer cells from the body at that point.
Okay.
So we just try and then prevent it from getting worse too quickly.
I think last week you mentioned that you could have cancer reoccur even after going into remission.
Yes.
Tell me about the chances of recurrence based on the stages, the various stages.
Okay, so I think the higher the stage at which you first discovered it, the higher the chance of recurrence.
Okay.
Yes. So if you discovered it earlier, the chance of recurrence is lower than if you discovered it at stage 3. So but the recurrence, that means you finished the chemotherapy and you were in remission before it came back again. So basically that is it. And also the risk factors, as I mentioned, the alcohol, smoking, obesity, those ones that we can modify, would have to also modify them, otherwise your chance will still also be a bit higher. And also younger age increases the chance of recurrence as well.
Rather,
yes,
if you're younger and you get breast cancer, then
so if maybe you get breast cancer at age 20, there's a higher chance you may have a recurrence later on in life.
For such a person, what do they do?
These things are on individual basis, and I can't give a general blanket thing, but some may opt to just do mastectomy at once so that they don't get it again. And there are hormonal therapies, different options actually available.
We have to wrap it up for today as well, because our time is against. I don't know if there's anything critical that you've left out we can look at before we wrap up for today.
Just one more thing. Some of the imaging tests, just because you do an imaging test and you don't find anything, doesn't mean you don't have breast cancer. You also have to also be examining and noticing what is going on with your breasts as well.
How often should you be doing that? It's like on a daily basis or weekly basis, monthly. What do you do?
Monthly should be fine. Monthly should be fine. But with the mammograms, if you are above 50 years, at least every 2 years you should go for a mammogram.
Okay. All right. Sometimes the situation looks bleak, but I'm sure with a lot of education, we should be able to,
we are going for early detection. So once we detect early, it's much better.
All right. Thank you very much, Doc, for coming on. So that's our series this month of October on breast cancer awareness. And so we do that every Monday, 2:45 here on The Drive with the Area Gang with Dr. Emefa Dzide from the Wejagbawe Municipal Hospital. So once again, thank you, Doc, for coming on. We'll go on with the show right now. And